Thank you, Tatsumewi. Good morning, Nimipu. Today we have a address coming from our medical director, Dr. Kim Hartwig, our EOC commander, Commander Antone, and myself. But first we'd like to start this morning off with a song from War Whistle and a few words from Executive Committee Casey Mitchell, too, who is a part of War Whistle as well. So we'll start this day off with the song and a few words by Mr. Mitchell.
Thank you, Mr. Chairman. Just want to share a few short words. Tatsmewi, Oikulom Huma, Kaulatiwama. It's good to be here this morning. Prayers for everybody. And Makis Kutsiaya for the Creator waking us all up this morning. And, when we thought about doing this address to the people, we think about the history of our people and what our people have gone through throughout the hundreds and thousands of years of not only pandemic, disease, war, everything that's been put upon our people. And we have a strength within our people that we turn to, that the Creator, this power, this medicine that the Creator has given us, each and every one of us, the power of prayer, the power of song, that binds us all together, not only as people, but to our spiritual ancestors and Mother Earth and this way of life that we all hold sacred to our hearts, which all holds us together as people. So when we think about what we're going through right now, and we don't want to steer away from the way of our way of life of prayer and song. So when we go through something like this, the pandemic, we think about smallpox. When that came through and affected our people, we did not steer away from our ways of life. We did not steer away from our prayer. We did not steer away from our song. So we thought it was really important for us this morning to sing, to share these songs that have been passed down from generation to generation that help our people find strength within ourselves, within each other, and us as people. So I just wanted to share those short few words of the medicine that we all still carry, the strength that we all still carry, that the Creator has given each and every one of us. We hold it strong. We hold it within ourselves. And we're very fortunate that we have this power and strength and connection, not only to Mother Earth, to each other, but to Haniwa, Creator. We're able to speak to Him directly. This is a gift that each and every one of us have. So when we're down and we're out, or we're hurting, we know that someone else is praying for us. Someone else is going to help us get through this. And that's what we're going through right now. To be able to have that confidence and positive feeling that Haniwa gives each and every one of us, that we know somebody is praying for us and that we're praying for somebody else. And when we sing these songs go out to everybody because they're made for everybody. So I just wanted to share those few words, and this morning we're going to sing the one verse of the flag song and then 2 verses of our chief song. So I just wanted to share those words before we sing and say Makis Kutsiaya to Haniwat. Makis Kutsiaya to all our people that are praying. Makis Kutsiaya for all of us that are praying for the ones that are hurting, the ones that are directly affected by this COVID-19, and that in times like this we do not separate ourselves from each other, but we bring togetherness to each other. Because no matter what we think about, there's always bottom lines of us being Nimipu, of what runs through our blood and the things we care for. Mother Earth, the water, there's everything that takes care of us. That is the definitive line that binds us all together as Nimipu people. So Kutsiaya, Makis Kutsiaya, Yochkalo.
Yeah!
war whistle. I appreciate that in this time of need, a time of prayer, a time of song, and a time of togetherness for our people. So at this time, I'd like to bring Dr. Hartwig forward, please.
Thank you, Chairman. That's maybe. Thank you for the opportunity to come before you today, and I just want to relay that NMPTEC Health continues to work tirelessly to serve our communities. Both Kamiah and Lapwai clinics are working to accommodate the needs of all patients to ensure we are providing the quality care you deserve. We know it's a privilege to serve you and your families. We greatly appreciate your patience and understanding as we work to meet all the needs of our community during the COVID-19 pandemic. To date, we have tested 108 individuals, totaling, of which total 17 positive cases of COVID-19 virus. The age ranges are from 1 year to 80 years of age. We have recently determined that we have community spread due to some cases not being traceable to an original case at this time. I would like to note that several of these positive cases were asymptomatic, meaning they didn't show any symptoms at the time of the testing. This emphasizes the need to continue practicing social distancing and stringent hygiene measures, as there is no sure way to visibly tell if an individual is infected. There are several unknowns about this virus. What we do know is that this social distancing is one of the true and viable measures against contracting the virus. We are fortunate to have the testing capacity to provide same-day results both at Lapwai and the Kamiah facilities. We are still limited on test kits, and there is no guarantee of when or if more will arrive, but we thankfully have been receiving kits weekly. However, despite this unknown, we will continue to test individuals. Knowing that we are such a tight-knit community, our priority is to assure that we have a grasp of the situation to help to mitigate it from worsening. We are collaborating with the North Idaho Health District to share numbers, data, and coordination of contact tracing process. The contact tracing process provides us with a list of people, of all the people a positive individual has come in contact with. We are then able to contact those people to come in for testing. I would like to give a reminder that if contact tracing indicates a person needs to be tested, they will be contacted by the Public Health District. However, as of May 11th, testing is now being provided for all medical patients of the clinic, both clinics, to help better understand the spread of the virus in our community. This expanded testing is in addition to the testing of those individuals who have had close contact with another individual that is tested positive, as well as those who are symptomatic. The expanded testing will be dependent upon our supply of test kits. If you've not been contacted, but know you have been in close contact with a confirmed case, confirmed positive individual, or you are showing COVID-like symptoms, we ask that you call NMPTEC Health prior to your assessment. Close contact is defined as being within 6 feet for 10 minutes or more of another individual who tested positive. Please be sure to call prior to coming to the clinic to help us prepare and avoid spread of this unprecedented virus. Please do not feel overwhelmed or frightened if we are using our PPE, personal protective equipment, during your appointment, as we need to protect ourselves so we can continue to provide you the care you need. Thank you for your continued support and trust at this time. Commander Antone.
Statius Lee, my name is Marty Antone, the Incident Commander for COVID-19. The Emergency Operations Center, or EOC, was enacted to help and make recommendations during COVID-19 pandemic. The EOC is a central intelligence area for personnel to gather critical information, coordinate response activities, and manage personnel as the emergency situation dictates. Let's see. We have a group of dedicated staff to assist NMPTEC Health, NPTEC, and our communities. This unique situation, and today marks what we call D plus 57 days of our response efforts. This is the longest standing disaster situation for Nez Perce tribe to date. Given this, we have had to make several adjustments along the way. Our biggest priority is assisting NMPTEC Health however we can and being a resource to meet their needs. The EOC makes recommendations to the policymakers based on local data, predictions, discussions with neighboring agencies, knowing that we are a unique region where I utilize regional data versus state or local county data. This ensures that we are getting the most accurate representation of data for the entire Nez Perce reservation. As a sovereign nation, it is our right to decide how we manage the situation on the reservation. This means the EOC will make recommendations specifically for the reservation. Regardless of what the county or state decides, we must follow our own path, knowing that several of our tribal members are already at higher risk for contracting this virus due to pre-existing conditions. The EOC is the living, breathing this COVID-19 pandemic. We research, teleconference with other agencies, inquire with experts, navigate through all types of information to ensure we are basing decisions off accurate information and data. We're working around the clock, odd hours, and sometimes on weekends to ensure we are doing all we can for health and safety of our people during this unique situation. I would like to thank NPTEC for being quick to enact the Emergency Operations Center and for putting people's health and well-being at the forefront of their decision-making process. Thank you. Junko.
Thank you, Commander Antone and Dr. Hartwig. Appreciate the information that you've provided today for our tribal membership and addressing their concerns that they do have. I'd like to thank Ms. Scott to the PIO for the EOC for all the hard work that's been done and the preparation for the information that is going out. Also, Dr. Hartwig too for her Facebook Live interaction with tribal membership for the questions that you had for her, and she was able to answer your questions and help you through this time. We thank you for that, Dr. Hartwig. This has been a strange time for all of us. The entire situation is new and things seem to change each day. We knew it was just a matter of time before it reached us, and when we received the news that we had our first confirmed positive COVID-19 test, we hurt for those families, for those tribal members that are out there. We prayed for those people. It is important to remember, though, while the virus can be life-threatening, the majority of individuals that contract it do recover. We know that our people will overcome. We had to make some challenging, impromptu decisions once the cases were confirmed. When the election judges and general counsel decided to postpone the elections and the 2020 spring general council, NPTEC responded by keeping our current NPTEC and resuming business through the month of May. While we have been taking several precautions, we continue to stress the need for our community to follow the stay-at-home order. This is critical right now, especially as areas around us are opening. Although some cities and counties feel it is time to start reopening, for the Nez Perce tribe, those decisions will be based on recommendations from our public health, true data, and our formalized phasing process. We do not want to see a resurgence in cases by jumping back into business too soon. However, we are planning and preparing for when it will be appropriate to open business back up. When we feel it is safe to do so, we will then start our new normal of operations. Right now, we continue to plan and make changes so we can accommodate social distancing, adequate hygiene, and enhancing sanitation practices in the workplace. NPTEC would like to thank the NMPTEC Health and all of their staff for rising to the occasion. Their team continues to push forward even when situations try to push them backwards. We have excellent leadership at the clinic, and we truly believe they are providing a level of care that is unmatched. We'd also like to thank the EOC. They stay submersed in the subject of COVID-19 and continue to be proactive in recommending appropriate measures that can be taken by the Nez Perce tribe for our safety and well-being. Lastly, we'd like to thank all of our staff. As trying as these times are, you have adapted and made it work. We have several staff who are balancing regular work and work on COVID-19. We have staff who want to come back to work, to the workplace, and get back to normal. We recognize the passion our employees have for the people and communities they serve. We appreciate you. Would also like to thank those people out there that have taken the recommended guidance and ran with that and stayed home, practiced all the things that you needed to do out there to prevent this from spreading and protect those that are most dear and loved to your heart. Thank you for looking out for those people that are the elderly, the people with underlying conditions, and we appreciate that for the work that you've done to keep your social distancing and to stay within your own household. It's very important at this time. It goes to the importance of staying vigilant, recognizing the challenges of staying home. Do it for your loved ones. Do it for your community. Do it for the Nimipu Nation. We know it's not a simple ask, but if we can do this together while apart, we will remain Nimipu strong. Thank you for listening in today. Thank you, the EOC Commander Antone, Medical Director Hartwig, PIO Officer Kaylani Scott, War Whistle, all the NPTEC members here today present, Arthur Brancho, Vice Chairman Mary Jane Miles, McCoy Oatman. Thank all of you and all the rest of the NPTEC members for working through such a difficult time that we face and will continue to face, and will continue to fight. We'll continue to place ourselves between the virus and our people and doing all the things that we can. So thank you. I would ask War Whistle to do one more song for our people, for the prayers of our people, for the strength of our people. So please, War Whistle. job, guys.
Yeah.